What causes erectile dysfunction in young men? If you're young and have experienced difficulties maintaining an erection, you're not alone. While erectile dysfunction, ED, is often associated with aging, more and more young men are facing this issue. But what causes it, and what can you do about it? Let's break it down. Main causes of erectile dysfunction in young men. 1. Stress and anxiety. Stress from work, studies, or personal relationships can affect your sexual performance. Performance anxiety, fear of not satisfying your partner, or negative sexual experiences can create a vicious cycle of worry and erection difficulties. 2. Emotional issues and depression. Mental health plays a crucial role in sexual function. Depression and low self-esteem can decrease sexual desire and make it harder to get an erection. Some antidepressants may also affect erectile function. 3. Unhealthy lifestyle habits. Smoking reduces blood flow, which can affect circulation in the penis. Excessive alcohol and drug use. Heavy alcohol consumption depresses the nervous system, affecting sexual response. Recreational drugs like marijuana or cocaine can also interfere with erectile function. Poor diet and sedentary lifestyle, obesity, high cholesterol, and lack of exercise can impair blood circulation, directly impacting erections. 4. Hormonal imbalances. Low testosterone levels can reduce libido and affect erection quality. Other conditions, such as insulin resistance or thyroid problems, can also contribute to ED. 5. Excessive pornography and masturbation. Overconsumption of pornography can desensitize the brain, creating unrealistic expectations and making arousal with real partners more difficult. Excessive masturbation, especially with a firm grip, can also affect the response to natural stimulation. 6. Circulatory problems and underlying health conditions. Although less common in young men, conditions like diabetes, high blood pressure, and cardiovascular diseases can affect blood flow to the penis, causing erectile dysfunction. 7. Medication side effects. Certain medications, such as those for high blood pressure, antidepressants, or anabolic steroids, can interfere with erectile function. How to fix erectile dysfunction in young men. If you frequently experience erectile dysfunction, it's important to take action. Here are some solutions. Reduce stress and anxiety. Practice relaxation techniques like meditation, yoga, or exercise. If performance anxiety is affecting you, speaking with a therapist can be helpful. Take care of your mental health. If you think depression or anxiety is impacting your sex life, seek professional help. Improve your lifestyle habits. Quit smoking, limit alcohol consumption, follow a balanced diet, and exercise regularly to boost blood circulation. Check your hormone levels. A blood test can help detect any hormonal imbalances that may need treatment. Reduce pornography consumption. If you notice that pornography affects your arousal with real partners, try reducing its use or resetting your sexual sensitivity. Consult a doctor. If the problem persists, a urologist or sexual health specialist can help identify the cause and recommend the right treatment. Conclusion. Erectile dysfunction in young men is nothing to be ashamed of. It's more common than you think, and in most cases, it can be resolved. Making lifestyle changes, managing stress, and seeking professional help if necessary can make a huge difference in your sex life. If you found this content helpful, don't forget to share it and follow us for more advice on men's health. Take control of your well-being today.